Hello, everyone. My name is Emily. I'm a clinical specialist from Razor Optic. Thank you for joining us our webinar. Today, we are honored to have Dr. Rue Mirska, who will be discussing her personal experiences and treatment approaches. Today, online seminar topic is DOE technology and Piccolo Premium Picosecond Laser, how to use its potential in the aesthetic medicine clinic and increase the patient satisfaction. There will be a question and answer session after the presentation. So if you have any questions, please use the question tab during the presentation. Moving on, I'd like to introduce today a distinguished presenter, Dr. Rue Mirska. Please give a warm welcome to Dr. Mirska.
Hello, everybody, dear colleagues. I'm really glad that I can be here today with you. At the beginning, I would like to say a few words about myself. I'm aesthetic medicine doctor, internal medicine specialist. I graduated with honors postgraduate studies of postgraduate School of Aesthetic and Anti-Aging Medicine of the Polish Medical Society, and also prestigious studies in American Academy of Aesthetic Medicine. And that's why I'm board certified doctor of aesthetic, American Academy of Aesthetic Medicine. And I am also a member of American Academy of Aesthetic Medicine. I'm a speaker and a trainer. Maybe some of you can see me at my lecture on IMCAS Paris this year and last year. And I'm proud to be a European key opinion leader of laser optic and also a key opinion leader for a Polish laser distributor, Euroscalemet. And last but not least, a very important thing for me, I'm a CEO and the owner of a Self-Esteem Aesthetic Clinic in Warsaw, Poland. Right now, you know the topic of our webinar. And I think that, of course, some of you are familiar with picosecond technology, so maybe it will be a quick reminder for you. But for those of you who are experienced with picosecond technology for the first time, I think that this is very important and crucial point to go through the way of action of picosecond technology, because we have to change the way of thinking, because some different non-ablative technology with longer pulse duration creates in the tissue microthermal zones, and we used to this term. But in the very short, ultra short picosecond pulse, we create in the tissue not photothermal effect, but exact photoacoustic effect with limited to minimum thermal damage of the tissue. And then we create not the thermal zone, similar to different non-ablative technology, but something different mechanism. Laser-induced optical breakdown, LIOB effect, and we have to remember about it all the time. Please look at the slide and the photo, how it looks like in the tissue. We create in the tissue not the columns, but we create the we create small vacuoles. And then, of course, this strong LIOB effect enhance effect of the tissue healing and thus increase production of collagen and elastin with a very short recovery time because of this almost non-thermal effect. What is really important also through this photoacoustic effect, we can break down the dye in the tissue into the really tiny microparticles visible for our macrophages. So then they could be easily removed from the tissue. Of course, it can be our exogenous ink like melanin, and artificial one like dyes we use, inks we use to for tattoo. And of course, through these all years, there a lot of trials appear. I advise you to search PubMed and to read about picosecond technology in tattoo removal, in rejuvenation, in hyperpigmentation treatment, also this very difficult melasma, and also in treatment of scars as well. I must admit that I'm working with picosecond technology almost 10 years, I think, because the history of picosecond technology starts in 2012, when FDA approved the first picosecond alexandrite 755 nanometers laser. Straight after I started to work with laser in Poland, and then my love to the picosecond technology started and appeared. That's why it's a quite long, or maybe for some of you quite short time when the picosecond technology is on the market, but a lot of trials appears, so it's good to know at least some of them. So when we want to summarize the indication, because of this action, it will be good for treatment of skin sagging, skin laxity, treatment of all types of scars, including, of course, acne scars, skin toning, treatment of any kind of discoloration, hyperpigmentation, also melasma treatment, and of course, removal of unwanted tattoos and permanent makeup. And of course, this treatment of hyperpigmentation in Asian skins and tattoo removal was the first indication for which this technology was created. And as I told you, we have a lot of different types of laser using picosecond technology. The Piccolo Premium is the sixth technology which I'm working with. And today I would like to show you what is unique in Piccolo Premium, because this uniqueness of this laser can give you better results for your patient satisfaction. And that's why you can use it in many different problems in your daily practice. This new generation of picosecond lasers uses the lasers manufacturer's patented DOE technology, diffractive optical elements. It is different for other technologies because most of lasers using MLA technology. And why DOE is better? This special optical construction divided the laser beam into 81 microbeams. You can see it on the slide. And each microbeam has the same energy intensity and the penetration depths, leading to the generation of shockwave and thus really strong Eliobi effect, stronger than in different MLA technology or older DOE technology. What else? This Piccolo Premium laser provides the highest stability in the both output energy and pulse duration at both wavelengths, 1064 and 532 nanometers. And we have to remember that, and it is for all lasers using picosecond technology, the Eliobi effect will not occur until the laser will be able to generate a sufficiently stable energy and regular pulse duration. And that's why this stability and peak power, pulse duration is really important when we work with the picosecond laser. Maybe some of you working with different laser had the problem during treatment of larger areas, like, for example, face, neck, and décolleté. After face, like in the half of the treatment, sometimes we could see that the power and the energy is not the same like at the beginning. For the piccolo premium, you can treat the larger areas without no such kind of problem. What else? My favorite and my unique technology, DIA FX handpieces for wavelength 1064, giving us possibility to work on the free penetration depths, but we can work on these depths selectively, and this is very crucial. We can start from the deeper part of the dermis. It is the level 1. Level 2, we work then in the dermis, but the closer to the basal layer of the epidermis, or we can work intraepidermal. What we can achieve with this technology, we can create selectively really strong LIOB effect on each layer, especially in the dermis. In some different technology, for example, we are limited because when we go through the laser through all depths, sometimes we can see the endpoint of the skin, but the energy on the deeper layer, it's not enough. That's why we see a good result in the epidermis, but not enough with, for example, deeper hyperpigmentation or with treating skin elasticity. And here we can create strong LIOB effect at each level. And that's why we can also customize the rejuvenation treatment or hyperpigmentation treatment for our patient, depends on a problem. And also we can customize the downtime, because, for example, if you would like to do the strong treatment because your patient can heal up, you can do this quickly. You can do this quite fast in a short time, like 15, 20 minutes. But you will see the petechia, you will see the small redness on the skin. Of course, this downtime, it's not very long. It will be like 2-3 days. But if your patient cannot even have such short recovery period, you can make the treatment without no downtime and no side effects. Of course, it will last a little bit longer in your office. You have to remember about it. And you have to tell the patient that, of course, the result will be similar, but the patient will have to wait a little bit longer for that result. What is also very interesting, we can work on these different layers of the skin without changing different tips with different lengths, because of course in different laser we can change the penetration depth, but we cannot act selectively. And here you don't have to use these different tips. You only have to use the twist and treat function, allowing us physician to change the penetration depth with only twist of the wrist. And now you can see on this slide these 3 different penetration depth. Please look at the slide. On each depth, we can see in histological examine that we have these vacuoles on each layer. So we create a really strong LIOB effect on each layer. That's why, for example, my patient see better results in tightening of the skin because we can create really strong injuries in the deep dermis without any problem on the surface of the skin. So we are safer, and the healing as I told you before, recovery period will be shorter. And what is also unique, please look at the right. You can see the penetration depth of the second DIFX handpiece. It is 532 nanometer fractional handpiece. And this is a really unique thing. Please look at the slide. We can see that the penetration depth, even if with this wavelength, is really big. We can penetrate with this wavelength to deep dermis. And you know that for other laser, this penetration depth will be like a half of it. So we can act safer with this wavelength and even stronger. And also we create very strong LIOB effect. We can see the vacuoles, which determine this healing process and this strong action. So, in generally, stronger LIOB effect give us stronger production of collagen and elastin with a short recovery period because of almost non-thermal effect. And what we can achieve in this way, I hope that with this first part, I show you why this laser can be better in your practice than different type of picosecond laser. But there will be also one thing you will hear about it at the end of the presentation. Please be patient. But here I will tell you one thing we achieve. As I told you, better, stronger result of rejuvenation and toning, and even sculpting of the face. Why it is possible, I will show you later. Now I would like to demonstrate the efficacy of this laser based on clinical cases. Most of them are mine from my clinic. So we start off action of picolar premium in tattoo removal. Of course, picosecond technology is really great and safe to remove permanent makeup removal. You have to remember that it's completely safe for the hairs. So it is better to use this type of laser in this area instead of, for example, Q-switch laser, in my opinion, of course. I've never had any kind of problem after removing permanent makeup in my patient. You can see here the result after 2 sessions. Of course, we use the full spot in such kind of problem, but I must admit that I work in also in this way with using fractional hand pieces to fast up this process and to make the treatment more effective as well. The next slide shows a really difficult tattoo. It was treated like 10 times before with Q-switch laser and 3 times with picosecond laser of different types. And the patient was really disappointed with the results. You can see that the place of the tattoo is also not very convenient, because we know that that removing of tattoos from the distal parts of our body is quite difficult. But please look at the results after 2 sessions and also after 8 weeks after second session. Here I use only the full spot size, but the result was great, and the patient was really satisfied with the treatment and with the this laser, because as I told you before, she was after 3 sessions of different type of picosecond laser as well. Next case, very difficult as well. It is color tattoo treated with Q-switch laser, with very cheap and not good quality picosecond laser, not in the medical place. And straight after the session, scar in the tattoo appeared because the healing process was prolonged. And the patient had almost all side effects which we can observe after bad treatment. And you can see the results with tattoos, with tattoo removal with Picola Premium laser, with 532 nanometers full spot size, with 1064 full spot size, and also the fractional handpiece to release the scar and to release the ink in this scar, to make the treatment more effective. And you can see this remarkable result. I was really surprised that also the green ink disappeared, because maybe you know that that maybe it's not a really exact wavelengths for the green ink, but here we can see that this DOE technology, this special fractional DIFX handpiece give us more and give us possibility to treat even different type of ink color. And the next tattoo, you can see here the result between the first and the second session. So I think that we can say that the improvement after only 1 session, like 50%, it is really good result. And here you can see the result after 8 weeks after second session. And now I saw the tattoo after this only 2 sessions, and it's really almost non-visible. So maybe after only 1 session, it will disappear completely. And now I would like to say a few words about DIFX 532 alone, and how I choose the right handpiece, because you often ask me how I do this, how I decide which handpiece will be good for each patient. And I must admit that last year, when I started to work, because I'm working with Picola Premium like 1.5 years, At the beginning, I used this handpiece only in combination therapy, but like over 1 year ago, I was asked by Laser Optic to show the result with after this handpiece alone. And I must admit that I was really surprised, because with many different lasers, this different picosecond laser which I'm working with in the past, I couldn't use this wavelength alone, because the result was really weak. And now you can see that in case of DIA FX fractional 532 handpiece, we have excellent results. And this is the first one. The patient who we wanted to do the skin rejuvenation, but also treat enlarged pores and acne scars, which was red. And now I know, and I advise you to use this kind of handpiece in such kind of problems, when you have red scars, when you have some spots of acne, when you have enlarged pores, because you can see that we can not only improve the skin tone to change the color of the scars, but we also have the great results in improving of the skin texture and whole rejuvenation of the younger skin for sure. But please look at the second patient. She's 40, and we do only one treatment with 532 nanometers handpiece, fractional handpiece. And you can see that not only the skin tone is better, but also we can see improvement in the eye area and near the nasolabial folds as well. And in the jawline, you also you can see that the skin is in better condition, and we can observe lower lack of laxity of the skin. And you have to remember that even after this laser treatment, the photos was taken like 4 weeks, sometimes 8 weeks after. This patient visited me last week, and I was really surprised, because her skin tone was even better, even after her winter holidays in Italy with skiing, of course using sunscreens, but the skin tones is improving on the with the time. And another patient, she's 38. We can see also great results after one session in skin tension, structure, and color. Please look at the pores and wrinkles on the forehead and on the collar or on cheeks, because please look at the cheeks, because I would like to show you something what is really important, because we can see the pigmented lesion of the right cheek of the patient, and till now I was used to use the full spot size to treat such kind of lesions. You can see an example, and I always was working with full spot size. like on this example, but when you work in this way, you maybe agree with me, you can see after removing the lesion that the skin is not, the color of the skin and the structure of the skin sometimes is not homogeneous. And that's why later we have to treat this place with non-ablative ablative laser or with picosecond laser with fractional handpiece. But now we have one tool which we can use in such kind of indications. Please look at the picture. Only after one session, these pigmented lesions disappear using only this fractional 532 handpiece. And the next patient, the same situation. We have here the acne, sun, and post-inflammatory hyperpigmentation together. We have lack of laxity. The skin is not in good condition, and please look at the eye area and the skin tone only after one session. With DIA FX 532, but I must admit that in this case I added the second level of 1064 10 by 10. And the next case, also the treatment with DIA-FX 532, we have the improvement in acne, in red acne scars. So as I told you, in my opinion, when you have this patient, it is really good indication to choose exactly this handpiece. Here you have the parameters which I used for each treatment. We undergo 2 sessions with this patient, and here you have you can see the filters. And I would like you to focus on the filters for vascular lesions and for hyperpigmentation. And we can see, of course, we can see improvement in hyperpigmentation. But I was also surprised because it's not a vascular laser, but this remodeling of the skin gives us also improvement with erythema. You can see that it's not as strong as before. So that's why I always start with such kind of laser, because this deep erythema can be improved after very strong remodeling with LIOB effect. And now we will go through action of DIA-FX 1064. And here you can see a very difficult case of melasma. The picture above, you can see the result after 4th session of different type of picosecond laser. After 2 first sessions, this patient saw the improvement, but after next 2 sessions, we didn't observe any reaction. And of course, you know that the patient wasn't satisfied with the treatment. I don't know how it is in your country. In Poland, still the picosecond technology is the most expensive technology on the market. That's why when we don't have any kind of improvement after the treatment, we can have a problem with our patient. And please look at the picture below. we can see result after only one session with picolophrenium. You can see a smile on her face because she was really satisfied with this laser, and she loved this laser. We still do the session of laser in exact periods of time. She's right now after 3 sessions, and now she's without any kind of problem on her face. Another case, young woman with hyperpigmentation after sunbath without sunscreen. And here we can see a result after 2 sessions. And I would like to mention as well, please look at the filter for vascular lesions. We also see the improvement. So when we do the treatment for hyperpigmentation, scars, and so on, we also can see that the redness of the face decreases with each session. Of course, we can see also the improvement in skin tone and the amount of pigment in the skin. And another case, which is a really good indication for 1064 nanometers wavelength of DIFX. It means enlarged pores and acne scars, even old acne scars. Especially, I use this tool for the patient who come to my office and claim that after CO2 laser, they saw the improvement at the beginning, and now everything stopped, and they wanted to find something else, something better for their skin, better laser, stronger in results. And we all know that we live in a hurry. So a lot of patients expect this very short recovery period. Very often it is really difficult for them to heal up like 7 to 10 days after CO2 laser. So picosecond technology as a non-ablative technology without thermal effect will be great in this case. Here I did also 2 sessions. The scars was visible mainly on the forehead, so we focused on this area. But of course, we did the treatment for the whole face. You can see improvement in size and amounts of pores and scars, but also another time the improvement in skin tone with pigment and with vascular lesions. And the last case of acne scars. And this is very important case because when we treat the scars and when we use higher amount of pulses, so when we add the higher energy into the tissue, we can observe not only the improvement of the skin texture, tone, and so on, and skin laxity, but we can observe something else. You can see the great improvement in this case of patient, but please look at the photos and look at the shape of the face. Do you see how it changes during the treatment? And with this case, I would like to go to the newest procedure of picolophrenium, which is unique and unusual. This procedure was created by Dr. Welschler from US. But when I heard about this procedure, I've decided to make the revision of my patient when and the cases in which I used higher amount of pulses. And as I told you, this patient before, when we see not only the changes of the skin structure, but also the sculpting of the face, I've noticed that when we go through the border of like 8,000 pulses for the middle and lower face, we can see the result of sculpting. So this procedure can be unique, can be a novel lifting procedure and sculpting procedure, safer, for example, than, in my opinion, than HIFU procedure. It is really very important in Europe. And that's why we can treat not only the skin surface, but we can go deeper. We don't know yet the mechanism, but I think that this really strong shockwave created in the deep dermis influence on also the ligaments, and that's why we can see the sculpting of the cheeks and also on the mandibular line, and then we can see that the tissue change their position. So we can thought that it is connected with changing of the tension of the ligaments and producing maybe more collagen also in this place. Of course, this procedure is safe for Fitzpatrick 1 to 3. So for the patient with lighter skin like American and Europeans, I think that more investigation are needed in Asian skins. But I think that when we observe the skin on the second layer, because of course when we work on the first level, we can't say that we have some endpoint or something like that. But when we want to add something more to the patient, we can make the higher amount of the pulses, and then we can create the stronger LIOB effect and achieve stronger result. But of course, we have to remember that with this amount of energy in the tissue, the healing process for sure will be longer. And we have to inform the patient that it will be like 3 to 5, or sometimes even with softer skin, to 7 days. And now you can see the resulting of the picosculpting procedure, only one procedure. So please notice the improvement in the eye area, in the cheek area, especially with lifting in this zygomatic line. And of course, improvement in the mandibular line. Of course, using such amount of energy gives us also magnificent improvement in skin tone and texture. I think that you see that the patient is really satisfied and happy only after one session. And here the same, only one session with picosculpting, and the improvement is really great. Of course, tone and skin texture as well. And last but not least, the results of difficult scars treatment, because it is challenging problem for physician in everyday practice. So we can use this powerful tool of DIFX fractional tool in the difficult scars. Please notice these burn scars with PIH. The result after one session is great. For the patient, the comfort of living is greater because she had the problems with movements with this hand. So patient is also satisfied. And here also the excellent result after only 2 sessions of treatment with very difficult scar. Please look at the upper eyelid and the contraction on the eyelid because of the really bad surgical intervention. You can see that after 2 sessions, this problem was resolved, that this tension was released, and the patient was really satisfied because she could close the eye, and before the treatment, she had big problems with it. And now we have the Q&A session. I hope that it was interesting for you. And now I'm here to give you more information which you are interested in.
Well, thank you for sharing clinical information and experience, Dr. Mirska. I will go ahead with the question and answer session. So once again, if you have any question, please use the question tab on the screen.
Okay, so now I see some question here. So what is the main benefit of Piccolo in the depth of 532? For me, the main benefit is that I can treat quite fast and with really good result the red scars. Sometimes with even still active acne. And what else? Also, when we have this different difficult hyperpigmentation, which I always used the full spot size till now. Now I use the fractional 532 because of the safer action and because of the changing and remodeling of the skin as well. So this is this was the first question. Now, how many shots do you need for the pico sculpting and what is the endpoint? Very good question. How many shots? Of course, it depends on a skin. When I have the very delicate skin, I start the first session with like 800-900 in total on two levels, level 1 and level 2. And when the skin is thicker, in case of men, I've started with 10,000 on 2 levels. I divided like half and half. Maybe, of course, it is difficult to say when is the end point with level 1, because we can't see this end point. So then I always use like from 4,000 to 6,000 shots. But in case of level 2, when I see the redness, purpura, petechia, this is my endpoint. But for sure, we have to say that that the patient will have longer recovery period. And the next question. Give me 1 second. How long does it take to get PICO sculpting procedure? And as I told you, it depends on number of shots, but in most of cases, it's like half an hour to 45 minutes. I know that this treatment lasts longer, but that's why in my clinic, this treatment is also more expensive because of the time and because of the number of the shots. And what about PICO sculpting procedure? Why do you not recommend to treat Asian skin type? I can't say that I don't recommend it to the Asian skin types, but now we have only experience with American and European patients. But I think that when we start with like 6,000 to 8,000 shots in Asian skins with 1064 handpiece, which is safe for these phototypes, I think that it should be really good result without any kind of problems. But I thought that more investigation in these phototypes is needed. That's why now we can say that safely we can use it in phototype 1 to 3. As your protocol of PICO sculpting, you recommend to treat as plus 10,000 shot at lower face area. Does it include hypopigmentation? Does it induce hypopigmentation? As you could see on the photo, of course, we can see the improvement in pigmentation on the whole face. I didn't observe any kind of hypopigmentation, but the skin looks brighter after this treatment. And that's why I told you also that we need more investigation in darker phototypes. Which is main advantage of Piccolo in front of all the competitors? And as I told you, for me, the special DOE technology giving us the very powerful tool with one of the shortest pulse duration, with one of the best peak power on the market, but totally creating really strong LIOB. And for sure, the most important thing is possibility to work on the 3 different layers of the skin, where we can put exact amount of the energy without problems on the surface of the skin, in the epidermis. Because you know, when we work in different picosecond laser, when we achieve redness, petechia, bleeding quite fast, we can't add more energy to the skin. And here, when we can completely avoid the epidermal layer and work in the deep dermis and the dermis near the basal layer, we can create the stronger LIOB in this depth. And of course, later, we can add this intraepidermal action. How we want to do this, and in the cases where we need it, for example, with pores, with deeper wrinkles, with scars. So that's why I think that it's main advantage in Piccolo Premium. What about acne scar treatment? What kind of acne scar that proper to treat with Piccolo Premium? In my opinion, all of acne scars can be treated with Piccolo Premium laser. I had very good results in all kinds of acne scars. And as I told you, also in very difficult scars like post-traumatic scars, after burn scars, and so on. And as I told you, because here is according to your experience with others. With other picosecond laser, I couldn't go deep enough. So I saw the improvement in more superficial layers, but I couldn't see the great improvement when the scars were deeper. And now I have great and powerful tool to put the really strong LIOB in deep dermis and to remodel, to give the remodeling of the skin and to see the better results in acne scars. What happens if we use 1 millimeter spot size for tattoo? I think that it's not a good idea to use 1 millimeter spot size for tattoo. I work in tattoo removal with spot size from 5 to 3 millimeters. Because we have to know that with 1 millimeter spot size, we are very superficial. This is the first thing. And then the concentration on energy on the very small surface is really huge. That's why I not prefer to use 1 millimeter spot size for tattoo removal. Okay, sorry. Next question. How often do you make the treatment yearly for sculpting? Okay, so this is a tricky question because the Pico sculpting is a quite new procedure. I was talking about Pico sculpting on this year on the European meetings in Paris. Dr. Welschler started to create this procedure like maybe half a year. So we have first patient with it, but in my opinion, when we do 2 to 3 sessions, it should be only once a year. And I recommend to my patient to do at least 2 sessions to see the good improvement and good results of Pico sculpting. And next question. What is the difference between performing the procedure with DIFX 532 and performing 1064? This is, give me a second. So what is the difference? Of course, when we use the 532 nanometers handpiece, we only can act in the deep dermis. So sometimes we need to add the 1064 with when we want to to create results on basal layer. But of course, because the wavelength is different, the healing process will be different as well. So when you use 532 nanometers DIFX, you have to remember that after the treatment, we see small edema, we see redness. Of course, it lasts quite short and appears in like 1 to 2 days. but you have to inform the patient about it. After 1064, you can perform the procedure without any healing process, or you can create, when you work on, for example, 2 different or 3 different layers, you can create maybe not edema, but petechia and small redness as well, using level 2 of 1064. So this is the difference between 532. That's why you could see that in one of cases mentioned before, I sometimes mix the 532, which worked very deep, with 1064 on level 2 to be more superficially. And the next session, and the next question, how many sessions do you need to get clinical result for picosculpting? As I said before, I recommend at least 2 sessions, but even after 1 session, patient can see also a great result. Okay. And this was the last question. Now I see that the lecture was really nice and helpful for you. Nice to hear it. If there are some more questions, I'm still waiting. I can't see.
Oh,
Or do we have some more questions? No. I think that that's
okay.
all.
Okay, I think,
So
yeah. I think that is all for Dr. Miska. Thank you for joining us today in this important event. And you're such a big help. And then thank you for everybody who participated. So if you have any question, feel free to contact Razor Optic. Once again, thank you for attending and have a great day.
thank you for listening. Have a great have a great day too. I hope to see you soon. Bye. Bye.